My name is Dr. Hilary Booth and I'm a naturopathic doctor. Welcome to my video blog. Today we're going to be talking about cardiovascular disease. Now, heart disease is something that as young people we often don't think about or worry about. We kind of consider it more of an older person's disease. But I want to start to get people to think about it at a younger age. You can just start developing the risk factors for cardiovascular disease at a really young age. This includes right from your early teens through your 20s, much earlier than most people think. So let's talk about exactly what is heart disease and why does it happen. So atherosclerosis is basically a big long word for the thickening of the internal walls of your arteries and your blood vessels. So what happens when those walls start to thicken is we get accumulation, proliferation, and calcification, and then lipids and other sorts of compounds start to get deposited on the inside of these walls. And this makes basically what we hear of as plaque formations in the vessels of the body. These plaque formations can dislodge, they can cause blood clots, which can cause difficulties in any organ in the body. We hear about it most often in the heart, causing a heart attack, or in the brain, causing a stroke, but it can also cause problems anywhere in the body. The other thing it can cause is a narrowing of the arteries, which is then going to contribute to hypertension, which puts more stress on the heart overall. So let's talk a little bit about risk factors for heart disease. A lot of people know that smoking is a major risk factor for heart disease and stroke. If you do smoke, please contact me. I'd be happy to help you quit. We also have alcohol drinking as a risk factor. Sedentary lifestyle, that means not getting up and moving around. We have a family history is a very strong marker of risk. So if for your family history, please speak with someone who's knowledgeable in your family and do a thorough family history about whether or not there is any instance of cardiovascular disease in the family. This includes hypercholesterol, this includes hypertension, this includes stroke, angina, or heart attack. These factors can give us really clear early indications that there is something going on in the genetics of your family, and that way we can take some steps to mitigate those risk factors earlier on. Another major risk factor, of course, is diet. So we're looking at having a diet that's high in saturated fatty acids, high in processed foods, and high in salt can contribute to heart disease. Other things that can contribute are diabetes and high stress levels especially. So please, again, you can get your stress levels tested by a naturopathic doctor. It's called a cortisol test. Please ask about that if that's a concern for you. I want to talk a little bit about inflammation though. So inflammation is something that we don't often think of as being associated with cardiovascular disease, but it really is. You can get testing done that is called your high-sensitivity CRP or C-reactive protein. You can also get your ESR done. These are two independent markers of risk factors for heart disease, and basically they're markers of inflammation in the body. So the inflammation is actually what's going to cause those plaque buildups to form and cause higher risk for developing heart disease down the line. Other things that you should get tested if you are concerned are your lipid levels. These are your cholesterol is what most people are familiar with, the term of what you should get tested. You can also consider getting a lipid panel done, and as I mentioned before, a stress test. So once you have all these lab tests and your strong family history, these things can help us to determine how much needs to be done in your life to help prevent cardiovascular disease in the future for you. So the first thing to always consider is exercise. You want to be doing moderate intensity exercise, at least 30 minutes per day, every single day, which I know sounds like a lot, but all you need to do is get out and go for a good, fast, brisk walk, get that heart rate up a little bit. The next step, of course, would be some more moderate to high intensity exercise. Cardiovascular workouts are always great, especially if you have the time to fit them into your schedule. It's highly encouraged. The other thing, though, that's not to be overlooked is weight training exercises. So research shows that the low-impact weight training exercises has a wide variety of health benefits. So especially for us girls who tend to not want to do weights because they think it's going to make us bulk up, that's not the case. You should definitely always be contributing weight-bearing exercise into your workout routines. So the next thing is diet. So we want to be having a diet that's high in fruits and vegetables, especially dark colored vegetables. So dark leafy greens like kale are a great example. We want to have it low in inflammatory foods, such as dairy tends to be inflammatory, gluten tends to be inflammatory, and some other different foods. Come speak to me if you want to know more about that. We want to have it low in your bad fats, so these are your processed foods, your saturated fats. We want to have it high in your good fats, so these are going to be fat sources like nuts, seeds, fatty fishes, olive oil, and avocado. Things like that are always great. We want to have lean protein, so we want to have lean grass-fed organic free-range chicken, and we want to have lots of fish. We want to be minimizing sugars, as high sugar diets aren't something we think of as being bad necessarily from the perspective of cholesterol, but high sugar diets, actually that sugar gets converted into bad fats in the body over time if we're not burning those sugars properly. So that's something else to consider. There are also different supplements that we can give if you have a higher risk factors for cardiovascular disease. So some of these supplements can be for specifically targeting lowering your lipid levels if those labs come back high. They can also be targeting lowering your levels of inflammation if those lab markers come back high. They can also be targeted at strengthening the cardiovascular system, the integrity of the arteries, the integrity of the heart, and the ability of the heart to pump the way that it should. So there's lots that you can do, absolutely, but the first and most important thing is to know your risk factors. So please go to my website, www.hillarybooth.com. That's HILARYBOOTH.com. You can fill out the contact page there if you'd like to contact me directly, or of course you can call the office and book an appointment, or you can book an appointment online from my website, and I'd be happy to speak with you more and run some lab tests if this is something that you think that you'd like to look into further. Thanks very much for watching. Take care.